Q community members can play a key role because Q community members are in organisations up and down the land in the NHS, and many of them will be in important and influential roles in their own organisation, and I think can support the chairs, chief execs, boards of those organisations really understand and help deploy improvement approaches in their own organisations and bring to those organisations they work in the knowledge and insight that they gather from being part of the Q community, who regularly share and reflect on what works and have access to the resources of the Health Foundation and some of the really kind of the leading thinking globally on improvement. So I think there's a key role for them. And certainly I would hope that they see the benefit of the impact framework and are able to support the deployment of that and perhaps help and guide their own organisations on their journeys to broaden the scale and scope of improvement that perhaps previously they've done in smaller pockets. The impact of Q and its members has been hugely positive. I've seen firsthand just the sort of drive, energy, enthusiasm of those colleagues. I do think it's created a movement for improvement, and I do think it connects with a sense of what is absolutely right, particularly in clinical settings, for a philosophy and approach that underpins a drive towards high quality care and an approach that engages heart and head. There's a clear evidence base for this, which Q amplifies, but there's also a deep, I think, personal and emotional commitment, which taps into what people join the NHS for. The core principles, the founding principles of the NHS, I think align strongly with the Q community's efforts and agenda and contribution.